Good morning, everyone. I am Dr. Subhash Chandran from Immanuel College of Pharmacy. The topic we are discussing today is special powders. The powder is defined as a uniform and dry mixture of one or more finely divided particulate matter of solved medicaments. Or the pharmaceutical powders are intimate mixtures of dry, finely divided drugs or chemicals that may be intended for internal or external use. The special powders are categorized into eutectic mixtures, hygroscopic and deliquescent powders, and efflorescent powders. The eutectic mixtures are defined as a mixture of low melting point ingredients which, on mixing together, turn into liquid form due to depression in melting point of the mixture below room temperature. They are mixtures of substances that liquefy when mixed, rubbed or triturated together. The melting points of many eutectic mixtures are below room temperature. Example of these substances which tend to liquefy on mixing are camphor, thymol, menthol. Any two of these drugs turn into liquid when mixed. This problem can be solved due to formulation of powders of such material by using inert adsorbents such as starch or talc. Lactose is also used to prevent dampness of the powder and dispense of the compounds of the eutectic mixture separately. The powders which absorb moisture from the atmosphere are called as hygroscopic powders. But certain powders absorb moisture to such a great extent that they go into solution are called as deliquescent powders. Both hygroscopic and deliquescent powders absorb moisture from the atmosphere. Examples of such substances include ammonium citrate, pepsin, phenobarbital, sodium bromide, sodium iodide, potassium citrate, zinc chloride, etc. Such substances are usually supplied in granular form in order to expose less surface area to the atmosphere. These powders should not be finely powdered. Such powders should be double wrapped. In humid weather or when dealing with very delicate substances, for their wrapping in aluminum foil or plastic cover is advisable. We see about the efflorescent powders. Some crystalline substances liberate water of crystallization wholly or partly on exposure to a humid atmosphere or during trituration and thus become wet or gets liquefied. Examples of such substances include caffeine, citric acid, ferrous phosphate, etc. This difficulty may be overcome by using corresponding anhydrous salt or an inert substance may be mixed with a fluorescent substance before incorporating with other ingredient. The problems pertaining to efflorescent powder include water liberated by the drug or chemical is triturated, which may cause the powders to become damp or pasty. The efflorescent powders, if water is released to the atmosphere because of low relative humidity, the drug loses its crystallinity and become powdery. The water of hydration is given off. A given weight of the resulting powder no longer contains the same amount of the drug. Hence, strategies for handling efflorescent powders include storage and dispense of these powders in airtight containers. The anhydrous form of the drug may be substituted for hydrate, but be sure to make appropriate dose corrections. Thank you.